I have a drooping right upper eyelid. Would it be possible to fix just my right eye? I know this condition runs in my family, from my father's side. A couple of years ago, his drooping upper eyelids were so bad that his insurance covered the surgery to fix them. A couple months ago, he had elective cosmetic surgery on his puffy under eyelids. I am fine with my left upper eyelid, but the right one is seriously drooping. It's terribly uneven when you look at me straight on. You would say it's pretty severe, correct?
Thank you for your question. You submitted 2 photos and you're describing a family history where on your father's side the eyelids tend to droop such that it was actually affecting his vision. And you're concerned about the degree of severity of the right eye's drooping relative to the left eye. So in order to understand what this is and then making decisions about what to do, let's get some terminology clear so you can learn more about the options. I'm a cosmetic oculofacial plastic surgeon. That's someone who specializes in eyelid surgery, background in eye surgery before specialized cosmetic surgery of the eyes and face, in practice in Manhattan and Long Island for over 20 years. So this concern that you have is something we deal with every day, all day long. There are 2 terms for a drooping eyelid that you should be aware of. One is called dermatochalasis. Dermatochalasis means there's excess skin over the eyelid causing loss of some definition over on the crease area and fullness over the eyes. The other term is called ptosis. Ptosis also means drooping of the eye, but in this situation it has to do with the position of the eyelid margin, the part where the eyelashes are relative to the center of the eye or the pupil. In your situation, there is a difference between the 2 eyes when you look at the definition of the eyelid crease on your left eye and the lack of a present or obvious eyelid crease in the right eye. Now, as far as severity is concerned, it's certainly not that severe in the spectrum of people who have extra skin over their eyes. In our practice, we make decisions with our patients about when is the right time to do something. Essentially, for excess skin over the eye or asymmetry based on soft tissue that includes not only skin but also fat that's behind the eyelid. You can certainly potentially benefit from a procedure called an upper eyelid blepharoplasty. Upper eyelid blepharoplasty involves a careful and artistic shaping of the upper eyelid that involves typically removal of some skin, removal of excess fat, and other soft tissue. It's not a generic procedure. It's very important that the surgeon who does this type of procedure thoroughly understands this anatomy and has a lot of familiarity. I find it's always interesting that it's a unique challenge when we treat a younger person because they're starting in a very good place and there are no wrinkles to hide anything, and it really has to be done as close to perfectly as possible. Looking at your photos, it certainly appears that you're very young. So the decision that you need to make is whether or not to do something now or wait till later. If the concern is that you want to have more symmetry and it's really foremost in your mind, then meeting with a cosmetic surgeon who specializes in eyelid surgery, such as a cosmetic oculofacial plastic surgeon, is something worth pursuing. If you look at yourself, and even if you ask your friends and family if they notice the difference, I would suspect most of them don't notice the difference between the 2 eyes. It's very common for people to look at themselves and be very hypercritical of their appearance. Ironically, it's a lot of younger people who tend to be hypercritical of their appearance. And of course, as one gets older, you look back and think, why was I complaining so much? You look pretty good, when you're younger, naturally. So, considering that we can refer to the asymmetry as just a matter of some degree of skin, possibly some fat excess over the right eye, the procedure that would address that would be a right upper lid blepharoplasty. In our practice, we perform this procedure routinely under local anesthesia and light intravenous sedation. This means that you get an IV or something that gives you some liquid sedative to relax you, and then under local anesthesia the procedure is performed. This is in contrast to general anesthesia or having a tube in your throat and being put on a respirator. With that being said, again, you have to decide, is this worth it to do? Again, and you have to look at yourself in the big picture, think about what the risks and benefits are of the procedure after you meet with the doctor, and make a decision after that. But it is clear, based on the photo, that the right upper eyelid there is a difference. There is a small amount of relative excess skin and possibly some fat accounting for this asymmetry. So I hope that was helpful. I wish you the best of luck. Thank you for your question.